Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health radio and television program on the radio at AM 1240 KNRY, AMP Cable Television Channel 24, and on the web at www.ampmedia.org. Join our rotating host and their informative guests live every Monday afternoon at 4 o'clock. The purpose of the Your Health radio and television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
I'm Dr. Lisa Hernandez, and I'd like to welcome you to Your Health television program on AMP Cable Television Channel 24 and on the web at ampmedia.org. I will be your host today, and my guests will be providing you with valuable information to help you improve your health. Today, my guests and I will be speaking about breastfeeding and its benefits. August is Breastfeeding Awareness Month. Did you know that breastfeeding is one of the most valuable measures that a mother can provide to her infant to promote their health? Health professionals agree that human breast milk is the most complete form of nutrition for newborns, including premature and sick infants. Breastfed babies are healthier and have a lower risk of death. Fully breastfed babies have less allergies and less infections, and breastfeeding reduces childhood obesity. My first guest is Carole Swain, and she is the lead lactation consultant at Natividad Medical Center. She received her registered nursing degree at Hernandez College and has been working at Natividad Medical Center for over 26 years. The last 5 years has been with Lactation Services. Carole is an international board-certified lactation consultant, and she was instrumental in establishing the outpatient lactation services at Natividad Medical Center. And that center just celebrated its first year anniversary. Carole, you've been very busy.
Very busy.
Thank you very much for joining us today.
You're welcome.
So let's get into the questions. Can you describe to our audience what the benefits are of nursing to a mom?
Well, recent studies show that women who breastfeed have decreased risk of breast and ovarian cancer, anemia, diabetes, obesity, osteoporosis, and more importantly, heart disease. They feel good about their ability to provide the complete nourishment for their babies. Both mother and baby enjoy the emotional benefits of this very special relationship. Besides, breast milk is available 24/7. It saves time, there's no bottles to wash or anything to prepare. And mothers get more rest as they're breastfeeding their babies. And it's free. It can save the family up to $1,500 to $3,000 a year. And a lot of times, in particular, the fathers don't realize that. And in today's economy, saving money is extremely important. And fathers can feel less financial pressure and take pride in knowing that the mother is giving the baby the best food possible.
Wow, so there's lots of benefits for mom, both physical, emotional, and financial. What about for infants? What are the benefits for them?
Well, you mentioned a few of them. Providing infants with human milk gives them the most complete nutrition possible. Human milk provides the optimal mix of nutrients and antibodies necessary for each baby to thrive. We kind of say that mother's milk is like the first vaccination for the baby. Scientific studies have shown that breastfed children have fewer and less serious illnesses than those who've never received breast milk, including the risk of SIDS, less childhood cancers, diabetes, infections, respiratory infections, and diarrhea. Research also shows that breastfed babies have higher IQs, as well as better brain and nervous system development. Dental, speech, and language development is much better. The list really goes on and on. According to UNICEF, scientific evidence has shown that breastfeeding could lead to a 13% decrease in death of children under 5 years old. If the infants were exclusively breastfed for their first 6 months and maybe up to the age 2.
Wow, so there's lots of reasons to breastfeed. And infants are healthier, they don't go to the hospital as often, they're smarter. Wow. And what about this focus? You mentioned about exclusively breastfeeding infants. So why is there a focus now on that sort of activity?
Well, the medical field has changed a lot in the last 50 years. The focus now is on evidence-based practice rather than just doing the things the way they've always done them. So they've done a lot of research, and the research really says that breastfeeding is like the #1 way to have a healthier life.
So we're talking about keeping a baby on breast milk as long as possible. That way they can get all the things and the best have the best chance of being healthy and not having ear infections and not having diarrhea and all the things that you mentioned before.
Right.
Great. And what about the community? How has breastfeeding, what kind of impacts does breastfeeding have on the community? And does it really make a difference? You talk about the fiscal, the financial stuff for the family, but what about for the community?
Well, it really helps the community as well. Mothers will call in sick less often. There's less absenteeism from work on babies that are breastfed. So that's going to save the employer money.
Good point.
Resources are used, the resources that are available are used to feed children and can be stretched farther when mothers choose to give the gift of their own milk. There's less tax money required to provide assistance to properly feed children. Families who breastfeed have more money to spend on services and goods, thereby benefiting the local community. When babies are breastfed, both mother and baby are healthier. This translates to lower health care costs for the family and a less financial burden on third-party payers, as well as on community and government medical programs. Hospitalizations, physician office visits are less. But really the most important thing is the increased quality of life. We know that Michelle Obama is really focusing on childhood obesity, and she's looking at breastfeeding as a way to counter that problem. And then recently the Surgeon General had a call to action to look at breastfeeding to alleviate this problem. Breastfeeding uses none of the tin, paper, plastic, or energy necessary to prepare, package, or transport artificial baby milks. So since there's no waste in breastfeeding, each breastfed baby cuts down on our pollution and the garbage disposal problem.
Wow, so what you first talked about was prevention. Prevention and the community benefits when we look at having a healthy infant. There's less healthcare costs, there's less impact on the healthcare in terms of using services that could be utilized for other people in the community. Less impact on a family because they're using the resources that they would use for formula on other children for their resources, as well as being green. And it sounds like we're getting a lot of support also from the government as well. And I know a number of us have heard of the U.S. Health and Human Services Healthy People 2010 was the last one. Now we have 2020, and they are focusing on breastfeeding as well. What are some of their goals for breastfeeding?
Well, Healthy People 2010 had goals and benchmarks to increase the quality and years of healthy life and eliminating health disparities. One of the focuses was on breastfeeding. But the Center for Disease Control said that 22 states did not meet any of the Healthy People 2010 breastfeeding targets, and that really underscores the need for continued work in this area. So now we have Healthy People 2020, and we've increased the target goals for national breastfeeding rates. The goal is to increase the proportion of the numbers of mothers who are breastfeeding their babies, and it includes initiation, more mothers beginning at the very beginning to breastfeed, duration, hopefully to 6 months to a year old, and the quality, the higher rates of just exclusive breastfeeding. And there's ample increasing evidence that these improvements would bring positive health effects, short-term and long-term, for both the mother and the child. Another goal is to increase the percentage of employers who have worksite lactation programs. Also to decrease the percentage of breastfed newborns who get any artificial milk in the first couple of days of life. And then the last one is to increase the percentage of live births that occur in facilities that provide recommended care for lactating mothers.
That's a lot of work, but it's doable. What about another movement that I know about that seems to help support some of those 2020 goals? A baby-friendly hospital. What are those? What is that movement about? What are the criteria and what are the concerns in that movement?
Okay. Well, the BabyFriendly Hospital Initiative is a global program sponsored by the World Health Organization and UNICEF to encourage and recognize hospitals and birthing centers that offer the optimal care for infant feeding. It began in 1991, and the basic goal was to have all babies breastfed for at least the first 6 months of life and continued to the age of 2. A special recognition is given to those hospitals that meet the 10 steps. The 10 steps include policy changes, education of mothers and family about the benefits of breastfeeding and the risks of formula feeding, and not accepting free formula.
I didn't realize that program was around for so long, 20 years now, and that it was an international campaign. And you mentioned free formula. I'm a mom and a former OBGYN, so I know that the whole campaign of providing free formula exists. Who gets it, and what is the notion behind that?
Well, a lot of the formula companies want the mothers to choose their particular brand of formula. So they supply all the formula, all the bottles, all the nipples that hospitals and birthing centers use. But a baby-friendly hospital has to pay for all of that. But in reality, if all the mothers are breastfeeding, there's very little cost to the hospital. And it used to be that formula companies would provide nice gift bags, diaper bags, with formula and other things in them. Well, that was the first thing to go, was out the door went the free diaper bags. And we really haven't heard of a lot of mothers complaining, where's my diaper bag?
So was that part of the baby-friendly movement, the campaign to removing the commercial campaigns from the formula industry?
Yes,
I didn't know that.
Yeah.
Wow, Carole, I am learning so much. So tell me more about the baby-friendly hospitals. Do we have any here in Monterey County?
Well, Community Hospital of the Monterey Peninsula has been baby-friendly for many, many years. Salinas Valley just got their designation several months ago. Natividad has been working on it, and we hope to get our qualifications and our designation next year in 2012. There's a lot of hoops to jump through, and some of the steps are more difficult for each hospital. Getting rid of the bags at Natividad was just really easy. We just said, don't bring them anymore. And Me Memorial in King City is looking at beginning the journey to become baby-friendly. There are actually only 114 hospitals in the United States that are baby-friendly, but there's over 15,000 baby-friendly facilities in the world. Now that was in 134 countries, but that's a 2002 number. So I'm sure by now there's several thousand more. So we in the United States, we're far behind.
That's true. And once you get that designation, is it something that you get for life, the hospital, or does that have to be renewed every few years?
There's some stipulations that you have to continue to follow all the baby-friendly guidelines in order to keep up that designation.
So there's some work there. Mm-hmm. So speaking about work, breastfeeding can be hard work. What are some of the supports that we have for women in the community? I know I breastfed my kids, and it wasn't easy all the time. What are some of the things that a mother can use for support when they have some questions or some concerns?
Well, all the hospitals here in this area have lactation consultants, internationally board certified lactation consultants on the service for the moms in the hospital. Now, CHOMP does have some outpatient services. We at Natividad are there 7 days a week. We have inpatient services and outpatient services 7 days a week. So if a mom's having trouble, all she needs to do is pick up the phone and call.
Can they walk in? You said 7 days a week for the...
We prefer them not to walk in, but sometimes the pediatrician offices do call and say they have a mother that's having some difficulty, and can we see them that day? And we will work them in, because if a mom's having breastfeeding problems, we want to be there for her, and we don't really care, where they delivered. So it's not just here at Natividad and excluding everybody else, but anybody who's having problems can come in. Mothers that have WIC can certainly go to the WIC office, but the WIC office is not open 7 days a week. So sometimes the WIC office will call us and have us see a mother over the weekend.
And if they need just some resources and don't necessarily need to talk to someone on the phone or have someone see them, where else can women go for some information about breastfeeding, even those that are considering it that are not even pregnant or have children?
There are a lot of websites that are really good. I'm going to plug the one for Monterey County Health Department. It is www.mtyhd.org. And if you click onto that site, then you will click onto Children and Family Services, and from there you will go to Lactation and Breastfeeding Resources. And there's lots of really good information. Monterey County has a breastfeeding guide in both English and Spanish that is very good. That is the same guide that you would find on the website.
So the yellow one is the English version and the blue one is the Spanish language one. So if you see these around, these are the guides for you to pick up.
Right.
What else you got, Carole?
BabyFriendlyUSA.org is another really good site. Center for Disease Control, the Academy for Breastfeeding Medicine, La Leche League. La Leche League has a lot of really good information in multiple languages. Sometimes we have patients that are not English speakers or Spanish speakers, and so we can click onto their site and print up breastfeeding information in multiple languages.
Well, great, Carole. Believe it or not, we only have about a minute left in this segment. Any few last words that you want, any pieces of advice, other information you'd like the audience to know?
Well, the big thing is don't give up, ask for help, and there is a breastfeeding resource fair coming up in a couple of weeks on the 1st of September at the Community Center in Salinas, and it's for any woman that is pregnant, and lots of really good resources.
And that's the Labor of Love, and that's on Thursday, September 1st, from 4:30 to 7:30 p.m. Thank you, Carole, for taking time out of your schedule to talk with us today. I learned a lot about breastfeeding, and in particular what a baby-friendly hospital is, that it's 20 years old, that campaign, and where to look for resources. We're going to take a break right now. My name is Dr. Lisa Hernandez, and this is Your Health television program. Don't go away. We'll be back in 2 minutes.